Good morning, this is Aoife from womenshealthdublin.ie. Just a little chat about pregnancy related sciatica. So I had a patient in this morning who's 20 weeks and has had sciatica on her right leg for the last 3 weeks. She's in a lot of pain, can't take painkillers, says it's 9 out of 10, difficulty sleeping, difficulty working. So the doctor referred her into me this morning. Did an assessment of her spine and her pelvis, and it's definitely coming from her pelvis, which is most common during pregnancy. The pelvic girdle is under so much pressure, and with weight gain and baby's position and hormones, the pelvis definitely reacts a lot. So it's not a disc causing the sciatica, but her pelvis causing the sciatica. So she's difficult putting weight on her right leg and lifting her right leg up in the air. And getting out of a seat, those first few steps really challenging. So the first few tips I gave her today were to try and sleep on her side with a pillow between her knees, to sit on a big Swiss ball. So you can get these big like birthing balls, which you will definitely need towards the end of pregnancy anyway. So it's a good investment now. So she could use that for sitting on her computer instead of a chair. It really gives great relief for the pelvis to bounce on it, to sit on it. And again, from now for the next 20 weeks, she'll get great use out of it. Size wise, I would say 55 centimeters unless you're above 5'7" in height, then go for 65 and get a good one. Don't get the kind of cheap little Aldi ones. Fitball is a great range. You can get them on physioneeds.ie or on Amazon. So invest in a decent one for about €25, because the other ones you just sit on and they just get really soft. So it's worth the investment. Another thing told her to do was to release her glute with a tennis ball. And if you don't have a tennis ball, an apple, a potato with a bit of cling film wrapped in it, and just rub it and massage it into your glute to release it a little bit. And then I told her to go for walks, because quite often you get up and the first few steps are awful, but then it loosens out. So even if you can do a 10-minute walk and it loosens it out, that will give you relief. She was sleeping on her back, not advised. Maybe she can tolerate that at 20 weeks. That'll change soon, but really, doesn't help with pelvic girdle pain. Pelvic girdle hates lying on the back. So lying on the side with a pillow between the knee is much better. Then heat hot water bottle on the glute. And then going forward, we really have to work on strengthening. So God love her, when she walks, she has a real waddle, which you really see with pregnancy, and it's the pelvis is just unstable on one side, so it kind of gives way. So we really have to work on strength going forward. So I've advised her to try and do some pregnancy yoga classes. Obviously with COVID, can't go in the pool, can't go to your local pregnancy class. So really frustrating, but there are some great online Zoom classes. The bumproom.ie is led by physios, so that's really good. When you actually have a pain, the physio will tell you how to modify the exercise instead of just telling you, oh, just stay out for this one or don't do this. They'll actually modify it and make sure you can join in with everything. And then if it's hurting too much, at least you can trust that they know kind of what they're telling you. So that's it. So starting with strength, release, heat, the ball. Oh, and the last thing was a bit of support. So either a pelvic support belt, which wraps around the pelvis itself, or other people find that actually support in the belly. So a belly support kind of sling that lifts the belly up off the pelvis can really offload things. So it depends on patient to patient what they find better. So she's going to go for the belly support. She's kind of got weak abdominals, so maybe that will really kind of take the pressure off the pelvis. So I hope that's been helpful for all those pregnant women out there with pelvic girdle pain or sciatica. You're not alone. It's really, really common. And in most cases, it will be gone after pregnancy. But obviously, you don't want to just put up with it for the whole thing. Physio really helps. It might not cure you completely, but it'll definitely improve your symptoms. So do see your local women's health physio if you're suffering with this and the symptoms aren't getting better. Hope everyone has a great day. I'm Aoife Harvey from womenshealthdublin.ie.